Hi, everyone. Thank you so much for joining us today. We will give it 2 more minutes maybe as the rest come in, but please feel free to put your name in the chat. Let us know where you're joining us from and which organization you're representing. So as we wait on the rest to come in, I'd like to introduce myself. My name is Dr. Masika Sophie. I work for the World Federation for Animals, and today I'll be moderating this debrief session. The session will focus on the World Organization for Animal Health, the General Session, and the World Health Assembly, which both happened in Geneva and Paris about 2 weeks ago. Just a few things to note as we start. There is interpretation both in Spanish and French. So choose a language using the globe icon at the bottom, the one that you prefer to listen to the webinar with. The session is also being recorded, and this will be shared afterwards with everyone who signed up for today's session. As I mentioned earlier, introduce yourself in the chat. I would like to know where you're joining us from and which organization you're representing. Then we do have a Q&A box. So in case as the webinar goes on, as we are discussing the topic today, please put your questions in the Q&A box. And if anything falls in the chat section, we'll transfer it to the Q&A box. Now, to start today, I wanted to mention that most of you do not necessarily focus on the international health policy because this is mostly policy rooms and discussions that are focusing on disease prevention, food systems, or international regulations. These discussions can feel a little bit abstract and highly technical that some of us feel it's out of reach for us. But that is why we want to do this session today. As I mentioned, that we want to focus on what happened 2 weeks ago. So between the 16th and the 23rd of May, 2026, about 194 member states came together in Geneva, Switzerland, to attend the World Health Assembly. This was the 79th session. This session resulted in many things, and some of them are the 20 decisions that were decided. We had 13 resolutions. And as some of you might have already seen in the news, the Ebola disease epidemic in the Democratic Republic of Congo and Uganda were declared a public health emergency of international concern. And lastly, there was a global commitment to change the global health architecture through a member state-led and a WHO-hosted joint process. Within the same week, between the 16th and the 22nd, in Paris, France, over 1,000 participants came together for the same reason, but their focus was animal health and welfare. So the World Organization for Animal Health is the highest decision-making body for the animal health and welfare part for all animal species. This is sort of an equivalent to the World Health Organization. And besides the 35 resolutions that were adopted during this session, there was 51 international standards that were revised, some were adopted, and all these were in the field of terrestrial or aquatic animals, disease prevention and control, animal welfare, diagnostic methods, and vaccine quality. There was also a massive celebration of 30 years of animal health status globally. Now, you may be wondering why this session is really important to animals and the work that you do. First is because the One Health approach clearly extrapolates the way our lives as human beings, animals, and the environment are intertwined. Secondly is because animals already sit at the center of public health. And lastly, for there to be good animal health, there needs to be a prerequisite, which is good animal welfare. So the World Federation for Animals, which is a member organization of over 80 international organizations, takes pride in being in this space to ensure that we are advocating for animals in the highest health policies and therefore implementation. Now, today we have a very lean but loaded agenda. We'll focus on three areas: the adoption of the updated Global Action Plan on the containment of antimicrobial resistance, the pandemic treaty, and specifically the pathogen and access benefit sharing annex. And we will touch a little bit on the Ebola disease epidemic and hantavirus outbreak that we may all know about. And lastly, we'll talk about the WOAH animal welfare chapters that were adopted during the WOAH General Session. To unpack this agenda, I'm joined by two of my colleagues, Nina Jamal from PAWS and Julia from Animals Angels. Now, health has very much been in the limelight the last 2 weeks, I would say. I would like to ask Nina to just come in and tell us what topics were at the top of governments at the World Health Assembly in Geneva. Nina?
Thank you, Masika. Hi, everyone. It's a pleasure to speak to you all today about the World Health Assembly and how the work links to our movement on animal welfare. So when the World Health Assembly started 2 weeks ago almost, the Director General of the World Health Organization, as Masika mentioned, announced Ebola as a public health emergency of international concern. And it was just a few days after the hantavirus and related outbreak was all over the news, and with countries reporting that their citizens had arrived and they were taking measures to test and explore whether they were infected with the Ebola outbreak. We have a much more worrying situation, more than 200 deaths and still spreading in a time where there's conflict in the region. So the World Health Assembly started in a very complicated environment. We had the outbreaks, conflicts, and a very unfunded health system that is not sufficiently prepared to support governments in these kinds of emergencies. So as an example, around 70% of countries have reported last year financial disruptions because of the funding cuts to their health systems. They cannot sufficiently fund their health systems. And this is a situation not just of inequity, but it's a symptom to a bigger problem.
Nina, so what has this got to do with animal welfare?
I love that question, and it's a very valid one, because the link is that human health does not exist in isolation. The way that we treat animals and the environment has an impact on us. And if we just look at Ebola, hantavirus, and even the COVID-19 pandemic, all of these pathogens have animal origin, and their spread is linked to a pathogen jumping from animals to humans because of the way that we treat animals. So there are several activities, human activities, that drive disease outbreaks. For example, anything that brings wild animals closer to domesticated animals, farm animals, and humans, the trade in wildlife, destroying their habitats to use land for agriculture or other purposes, the way that we farm animals, thousands of chicken or even mink put into spaces that are not appropriate for their basic needs, in a way that puts them under stress, makes them more susceptible to diseases. So there are several ways that we are handling animals and their environments that drive outbreaks. And very often we are in a situation where we start taking care of the problem after the crisis. So with Ebola or the hantavirus or COVID-19, these are pathogens that we have addressed far too late, after animals and people have suffered.
Thank you so much, Nina. I also want to understand how the World Health Assembly contributed to the advancement of animal welfare during this public health forum.
There were a few exciting developments. So with, you mentioned the pandemic agreement. The pandemic agreement was created during the COVID-19 pandemic, and it was adopted last year in last year's World Health Assembly. And it was the first time that the One Health approach that recognizes the interconnection between human, animal, and environmental health was captured in a legally binding instrument. Governments agreed to design strategies that aim to prevent disease outbreaks through this One Health approach. And this is relevant for animal welfare because these strategies will include measures to protect animals. Governments are going to analyze where are the risks, what are the hotspots where diseases might jump from animals to humans, what can we do to prevent these outbreaks at the earliest possible stage, and engage the communities that come into daily contact with these animals so that they are part of designing the solution, and so that the solution also gets implemented. And after the pandemic agreement was adopted, currently you had also mentioned an annex. There is an annex to the pandemic agreement. It's about pathogen access and benefit sharing. So it's related to if an outbreak emerges, so if we have a pathogen that can become a pandemic, governments are now discussing how they're going to get from the pathogen becoming getting reported to the pathogen data going through databases, and when there's access to that data, what's going to happen with that data? Are companies or academia going to develop vaccines? What other ways will governments get support so that they can protect their citizens through capacity building, research and development, financial support, so that their communities can be protected from these disease outbreaks? So that annex is a very important annex for equity, helping governments be in a position to protect their society. And that annex was discussed for the past year. Its negotiations were supposed to conclude this year, but governments decided that they need more time. So these two topics were on the agenda. And otherwise, there were a couple of other very relevant points for public health that have an impact for animals. One of them is a strategy on the economics of health for all. And the reason why this is interesting is because it's about a change in mindset. So one of the changes in mindset we saw with the pandemic agreement was governments were no longer waiting until an emergency. They were thinking about what needs to happen to prevent it. How do we protect animals and the environment so that we can protect human health? With the economics of health for all, governments are looking at health not as an expense and as a cost. They're looking at it as an investment. And the idea is if we invest in a healthy community, then we can ensure that we prevent the problem from happening in the first place. If we have access to clean water, access to basic services, if the health of the environment and animals is also secure, then we are taking early steps to prevent the crisis. And the third relevant process was something that Masika mentioned, which is the global health architecture reform. Governments have recognized that the health system is not just underfunded, it's also fragmented. We have a situation where there are different parts of a health strategy that are designed in silos. So we're not thinking about how climate change can affect health sufficiently. So there are several reasons why governments decided to reform the health architecture, and there was a decision to start that reform now with the aim of making it more robust, resilient, and coherent, so that governments can develop better strategies and protect health for all.
So now that this discussion has happened, the last 2 weeks, the annex has been negotiated but not yet adopted. What comes next after the assembly?
There are several steps that we're anticipating. One of them is, as you mentioned, Masika, the annex to the pandemic agreement will be further negotiated with the aim to submit it for adoption by the next World Health Assembly. So governments are going to be negotiating in Geneva for the coming months to finalize that. And then governments will start working to implement the pandemic agreement. And here we're anticipating that there will be strategies that will be designed to prepare for and respond to disease outbreaks. Another key moment that's coming up this year is there's a high-level political declaration on pandemic prevention, preparedness, and response, which is going to be negotiated in New York and is going to be tabled at the UN General Assembly this September. And this political declaration is also very important for our work because the UN in New York is a more multi-sectoral space. It's not a traditional public health space, which means that governments are going to also look at the role of other sectors in contributing to pandemic prevention, prevention, and response. And here, animal welfare, addressing the root causes of disease outbreaks by protecting animals and the environment is going to also be a component that we, as 4PAWS, but also several NGOs within the World Federation for Animals are going to be advocating for together.
Thank you so much. So what I'm hearing from you, Nina, is that governments do not necessarily have to wait until the adoption of this annex to start working. As we've already seen, we already have Ebola epidemic, we have hantavirus. We don't need to wait for this document to actually do the work on the ground to
By all
protect.
means. Yes,
Yes.
because the resolution that was tied to the adoption of the pandemic agreement in 2025 included a commitment by member states to start implementation. So indeed, you are spot on. Thank you.
Perfect. So in the same wavelength of prevention, during the same World Health Assembly, there was an adoption of the Global Action Plan on the containment of antimicrobial resistance, and that is what I'm going to talk about. So for those who are in the call and don't know what antimicrobial resistance is, this is a phenomenon where microbes are not responsive to the medicines that are supposed to contain them or treat them. So the last 10 years, the World Health Organization, in this case I'll use WHO, came up with a roadmap for member states to use on how to contain antimicrobial resistance. This was done together with the Food and Agriculture Organization, the World Organization for Animal Health, and the United Nations Environmental Program, because antimicrobial resistance is one of those, we call it a wicked problem that requires approach from all the health sectors. So member states have implemented this for the last 10 years, but then it was time to look at the lessons learned from the last 10 years and see what needs to change, because this was a very fast blueprint. So for the last 1.5 years, these same organizations came together and worked in a way to facilitate multi-stakeholder consultation, both from member states and from other non-state actors, including our civil society, to say what would the next global action plan look like based on the work that has gone into it the last 10 years. Now, during the World Health Assembly, this updated global action plan was adopted, and there was a couple of key changes that we now see in this current draft that is important for animal health, animal welfare as an area. First of all, is the current global action plan now has 6 pillars. The previous one had 5 pillars. And one of the most important pillar in the current global action plan is prevention. Previously, the global action plan, that pillar was named infection prevention and control. When you typically Google infection prevention and control, this is a term that is mostly used in the human health sector, mostly referred to as IPC. But the current pillar is much broader, and it specifically mentions prevention and control in all the sectors to contain AMR. This is really important because we now have a pillar that recognizes that AMR or antimicrobial resistance touches on all the sectors and creates an entryway into how the animal health sector, the environment sector can contribute to the containment of antimicrobial resistance. Second, under the prevention pillar, we particularly have the mentioning of RhinoPharm 5G framework, and this is a framework that specifically mentions good animal welfare as one of the approaches to be able to contain antimicrobial resistance. I would say this is a really big win for the animal welfare or the animal health and welfare sector, because we have had to continuously advocate that animal welfare has to be explicitly mentioned for it to be implemented. So previously, member states would look at biosecurity and sometimes vaccination and animal welfare as interchangeable words, but really it's not. When you look at animal welfare as a definition or a principle, there are very key 5 principles that the World Organization for Animal Health highlights as important to be implemented first for you to say this is good animal welfare. And lastly, in general, the world is looking towards prevention more than response. The first global action plan was a response because this was a phenomenon that took the world by storm. I mean, it had been developing for years, but now we are at a stage where we realize we actually can prevent the expansion or the propagation of antimicrobial resistance, and that is what I see the current global action plan focusing on. Now, I also want to highlight the fact that when we look at biosecurity and vaccination as a component within this current pillar of prevention, vaccine efficacy or effectiveness of vaccines when you use on animals, they want a compromise when an animal is not kept in good husbandry or for good housing system, good ventilation, food provision, and access to health services. So all these things have to work. I look at it as really pieces of a puzzle. If one piece is missing, the puzzle is entirely complete. And without animal welfare, this piece of the puzzle is not complete. Now, you might be thinking, what next? Now we have this big document, this global action plan. What does it look like for governments or for communities, people who are working with communities and farmers on the ground? For us, this looks like supporting the people on the ground in member states into now translating this updated global action plan to their national action plans, and specifically the new elements that have been incorporated in the global action plan. And animal welfare is one of them. I think the best place to start would be to create, for member states or governments to understand what is a baseline of animal welfare in your own context, in your own countries. Like I've mentioned, the principle of animal welfare is the same, but the application of it is very different because the social, economic, cultural, and religious backgrounds of countries are completely different. So understanding that background or baseline is so important because we cannot implement what we have not measured. Second, I would say is we need to still prioritize prevention even within this same prevention pillar. But prevention looks like protecting communities first or protecting farmers first before we put restrictive measures. Otherwise, if we member states going in and reduce, for instance, the use of antimicrobials without putting in enough access to veterinary medicines or enough access to how countries are able to come up with good housing systems, who suffers? It's countries, it's farmers, it's the economic impact that these players face, and then this becomes really regressive. And lastly, let's look at some of these issues that are economically viable. Look at the lowest hanging fruits, which are the easiest to implement so that we make a few strides ahead of implementing the new provisions in the Global Action Plan. Now, I have mentioned that the animal welfare principles were developed or are developed and updated by the World Organization for Animal Health. In the same breath, because antimicrobial resistance is a challenge that requires to be tackled from the animal health side, human health, and environment, this same global action plan was adopted and endorsed by the World Organization for Animal Health during the General Session. Now, I would like to invite Julia to come in and explain a little bit more on what these animal welfare standards I'm mentioning are, or from the World Organization for Animal Health.
Thank you very much, Masika, and good afternoon, everybody. Masika just already briefly introduced the World Organization for Animal Health, in short WOAH, to you, but I would like to explain a little bit further why it is so important for us, animal welfare organizations, to collaborate with WOAH and also to attend the WOAH General Session, which is taking place every year in May in Paris. So WOAH is the international organization that is responsible for improving animal health and animal welfare worldwide. And among others, WOAH develops international standards on animal health and animal welfare, which are adopted by all 183 WOAH member countries. And these standards are highly important for animal welfare because they provide globally recognized guidance on issues such as animal transport, for example, the slaughter of animals, killing of animals for disease control purposes, dog population management, also working animals, for example. So, and also WOAH cannot directly enforce its standards. These standards strongly influence national legislation, the veterinary practices, the trade with animals worldwide, and also the animal welfare policies that we have worldwide. And in many countries, and especially in the ones that don't yet have any animal welfare legislation, these WOAH animal welfare standards are really the key reference point and the only reference point to improve animal welfare. And this is why it's so important for us. And this is also why every year we attend the General Session in Paris. And there, what we do is we want to follow the discussions in the standard setting process, especially, of course, the standards on animal welfare. We want to engage with the member countries, with stakeholders. But firstly, we are there also to strengthen the presence of animal welfare and to strengthen the consideration of animal welfare in these very, very important international processes. So coming to this year's general session, the article 7.5.30 of the chapter on animal welfare during slaughter was adapted. So this year it was only one article of one chapter on animal welfare that was adopted. And this article concerned the electrical water bath stunning of poultry.
Julia,
So
what does electrical water bath stunning of poultry actually mean for those in the audience?
Yes, I can explain that briefly. So what does it mean? So stunning, first of all, means that the animals are rendered unconscious before slaughtering. And this is aimed at reducing the pain and the suffering of the animals during the slaughter process. And when we look at the electrical water bath stunning, so what happens is that the birds, the poultry, are hung upside down on a moving line. And their heads, they pass through electrically charged water. And then the current flows through their body up to the metal shackles that hold the legs of the poultry, of the birds. And of course, to ensure that this works effectively and that also the birds are effectively stunned, that means that the parameters for the stunning that must be correct, of course. And these parameters include, for example, the strength of the current, of course, the voltage, the frequency, the duration of the exposure of the animals in the water, also the size of the animals, the species, the cleanliness of the animals is important, and of course also the proper contact with their heads in the water bath. So what was the issue here? The central issue, the discussion was about the electrical frequency. And well, why did we find this so interesting? Essentially because, summarizing very much, we can say that was a discussion of meat quality versus animal welfare. And why was this? So the proposed wording of this article included, in general, lower frequencies ensure effective stunning, while higher frequencies provide a lower probability of successful stun, even at highest intensity current. So, but what? Low frequency electrical water bar stunning causes strong muscle contractions in the birds, as each pulse is long enough to cause these strong contractions. And these violent contractions in the bird, they can lead to broken bones, to bruising, to hemorrhages, to also damage in the wings and the muscles. And this results in poor carcass and poor meat quality. And I must say, at the first glance, that really sounds awful. But also at these low frequencies, with the longer pulse, they are more effective at inducing the unconsciousness of the birds. And even with the low frequencies, most of the birds, they will really die immediately by a cardiac arrest. And therefore, these low frequencies are considered better from an animal welfare perspective. But on the contrary, with the high electrical frequencies, they cause less violent muscle contractions and therefore also reduce the broken bones, reduce bruising, less bleeding in the meat, and less damage to wings or muscles. And as a result, with the high frequencies, the carcass and the meat quality are improved. But the problem is that with the high frequencies, the stunning may be less effective. And there's a high risk that the animals are only immobilized and they're not stunned. So they are still conscious during the following slaughter process. And yes, and this is actually the discussion was about this here.
Julia, does this have
Yeah.
any public health or food safety implications or concerns?
Yes, we can also say that this has a public health or food safety implication. And yeah, I would like to allow myself to quote the delegate from the UK, she explained it very clearly. So she said that good animal welfare at slaughter is not only a moral obligation, it is also a matter of public health. Animals that experience pain, distress, or fear at slaughter undergo physiological stress responses, which can increase the release of pathogens into the bloodstream and surrounding tissues. This raises a risk of contamination during processing and compromises food safety. Humane handling and effective stunning, therefore, serve a dual purpose. They protect animals from unnecessary suffering and reduce the likelihood of pathogen transmission to humans. So that was what she said. And yeah, it means actually that the high frequencies could also have a negative impact on food safety and public health. So, well, at the end, as a result, the article was adopted as it was proposed. And that means giving preference to the low frequencies in order to ensure that the birds are really effectively stunned during the slaughter process. And this is clearly very positive for the animals, and I think it can really be seen as a win for the animals and an important step to really giving priority to animal welfare over meat quality interests and so interests of the industry.
Thank you, Julia. That was such a simple explanation for such a technical area of work that you've been engaging in. Now, this is one of the welfare standards that we were very keen on, as you've mentioned during this general session. Would you say governments are mandated to implement these standards as they are?
Well, the WOAH standards, they're not legislation. They are not legally binding as laws or as treaties. But we have also to see that the 183 WOAH members, they committed themselves to comply with the WOAH standards. So it's a kind of self-declaration, or how to say. And yeah, the WOAH standards, they have really high weight because they can be seen as globally as the benchmark for animal welfare, no? And so they're also the reference, likely for the national legislations. And yeah, I think WOAH and also the many WOAH member countries and also partners of WOAH, like the International Coalition for Animal Welfare, really invest significant efforts in promoting and supporting the implementation of these standards. And yeah, maybe a bit coming back to what you were explaining before, I think one statement that also clearly marked the way forward for animal welfare during the general session was that animal welfare should no longer be seen as an additional cost, but as an investment in the future. And I have the feeling that also, after the general session, that really it is noticeable that more and more countries are recognizing that animal welfare is important, and that prevention lately is better than cure, not what you were saying before, and that good welfare is very, very closely linked to the animal health and also to disease prevention. And that animal welfare is not only an ethical responsibility that we as animal welfare organizations promote, but it's really really essential part of preventing disease outbreaks worldwide.
Thank you so much, Julia. I also want to mention that during this general session, there was a key message, as you've mentioned, that animal health and welfare needs to be considered as a public good. And then we're looking at this prevention and the fact that most of the zoonotic diseases we are seeing now, or epidemics and outbreaks, are originating from animals more and more. We saw that with COVID, we've seen that with Ebola and the hantavirus. I want us to go into the Q&A session a little bit and direct this to Nina. Nina, do you think we are ready or are we prepared to prevent the next pandemic?
That's a very good question. Sadly, we're doing everything to drive and increase the risk of disease outbreaks, because the way that we're treating animals and their environment, so factory farming, all those root causes of disease outbreaks, the trade in wildlife, among other risk factors, are still an issue, and governments have not invested in their sufficiently in their health systems. They were relying on support from donor agencies. So there are several reasons why our system is not yet prepared for the next pandemic. However, we can be hopeful because the pandemic agreement was adopted. Governments have committed to designing strategies to tackle the root causes. There are several governments that are implementing a One Health approach to addressing disease outbreaks. So there are lots of lessons that we can learn from governments, from communities, from scientists, academia, and civil society. So the short answer is not yet, but we have reason for hope with the pandemic agreement, with investing in animal health and human health, looking at the economics of health for all, revising the health architecture. Governments are taking steps towards that direction.
I would say so. I think if we looked at the global health architecture the last 10 years, it would have been a bit of a dream to imagine animal health and welfare being in a human-focused policy process, but we are seeing more willingness from some governments to want to understand how do we prevent it, which angles do we use to prevent it. At the end of the day, we see there's an economic impact to it, in the sense prevention is cheaper financially than response. But most importantly, prevention has an equity angle. It protects communities before that disease occurs, if we are looking at it from a community angle. Now, there's one question from David. David is asking, was there any discussion on religious slaughter reference the recoverable stand, and how did they square the circle of providing welfare for standing and ensuring halal can use with demonstrating of a recoverable stand? I think this is to Julia. And before Julia come in, please, if you have any questions, put them in the Q&A box for our panelists to address them today. Julia, did you get the question?
Yes, I think I got the question. So the question was if there was also if the discussion included also the slaughter without stunning. So just to repeat, maybe at this year's general session, the discussion was really only about one article, and this article concerned really the stunning of birds. Nevertheless, in the background, there was also a discussion on religious slaughter. It also, in a way, concerned the frequencies because, well, the parameters of the stunning, because with the high frequencies, the stunning is reversible, so the animals can get conscious again. So it's something that could be preferred by some religious groups, not Jewish groups or Muslim groups. But this was a bit of discussion aside. During the discussion on the article in the general session, for example, the delegate of Bahrain, she also asked a question about the slaughter without stunning. But as I said before, it was not the subject of the discussion. And yeah, I think if I remember correctly, so the president of the Code Commission who was leading the discussion was saying that they would look into the question that they received from Bahrain, but it was not topic here. As if I understand correctly, the slaughter chapter, it gives preference to the slaughter with stunning, stating that without stunning, there's a higher probability that the animals suffer and feel pain during the slaughter. So I think from the slaughter chapter, at the moment, there's a certain preference to the slaughter with stunning, if I read it correctly. Nevertheless, of course, WOAH has to embrace the interests of all member countries and the different interests, cultural backgrounds of the different regions must be included, of course, and of course, all interests must be included in the discussion. But it was not the main discussion here in this year.
Thank you, Julia. I think we always see a level of compromise because getting 184 member states to agree on a particular element of discussion is often very difficult. So this was one of the best case scenario in terms of the compromise prioritizing animals in this case. Now, Nina, you mentioned that we are not yet there in terms of pandemic prevention. What could we do to convince other member states who are not on board on this to get on this bandwagon of pandemic prevention?
That's a great question. So one of the main arguments that we have seen and is very reasonable is that prevention costs a fraction of response. So prevention costs 5% of if we were to go through another pandemic. At the moment, government's resources are stretched. They're going through economic challenges. Some regions are going through conflict, which means that they cannot afford to be in another crisis. Health systems have not yet recovered fully from COVID, and it will add additional strain to very limited resources. And if we invest in protecting animals and their environment, we're also investing in human well-being. This is the part of the premise that is tied to the One Health approach. If we're preventing at source, we are also protecting communities. We're investing in their prosperity. We are following a collaborative approach that moves away from silos. So there are several layers of reasons. One of them is the cost. The other one is the current crisis. The other one is the fact that there are co-benefits to protecting animals, and on the global level, preventing pandemics also helps address other crises. Like tackling pandemics also is linked to preventing, reversing desertification, addressing biodiversity loss, contributing to climate action. So the entire issue of pandemics and health also does not exist in isolation and is linked to several other priorities we're working on globally. So many reasons.
So money is always the best angle to use when you talk to governments, because as you mentioned, they're dealing with multiple crises at the same time. So the one that is able to save the cost the most is what they would focus on. Thank you so much, Nina. We have a question from Julie in the Q&A. Given that the standards of WOAH are not legally binding, is there anything that WOAH can do, or are there any procedures that WOAH engages in, such as producing a list of countries that have versus those that have not implemented legislation or regulations to hold countries accountable for their actions or inactions? Julia?
Well, first of all, WOAH is not an enforcement body, no? So WOAH is like they put at the disposition these standards that can help countries to improve their welfare and to improve their animal health, but it's not an enforcement body. And they have tools like the PABS tool, for example, where they look and evaluate the performance of veterinary services. This is something that helps. Then there's the observatory, for example. This is a body within WOAH that looks in the implementation of the standards, how far the standards are implemented. And I think what is really the most helpful tool in my consideration is really training, capacity building, to go into the countries, to work together with the animal welfare focal points, or also, of course, focal points on that cover other topics, to do the workshops, to enhance communication between the countries. I think these are the most important tools. And lately, when there's an understanding of the countries, and when they really say, okay, let's say they own the standards, no, they decide we want to comply with the standards. That's much more useful than having enforcement tools. So I think, for me, I think capacity building, training are sometimes really more helpful, more valuable than enforcement tools. So even so, sometimes, especially when we look at the countries that don't have their own legislation, when regions where there are many countries that don't have proper animal welfare legislation, or only cover some aspects of animal welfare. Of course, then we sometimes would wish that WOAH would be an enforcement body and could really enforce the standards, because there's nothing else. But yet, it is not the case. But there are tools to really improve the implementation.
Thank you, Julia, for that background. I want to go back to Nina, and we have a very encouraging comment in the section by Eli, who says that she would add that this also helps to show governments that they themselves are already doing One Health or pandemic prevention on the ground within ministries of health or diplomats in New York. Do you want to add more context on this, Nina?
Yes, absolutely. And Ellie was one of the advocates for the One Health approach and animal health and welfare in the pandemic with several other colleagues. Indeed, we noticed that diplomats in Geneva and New York were not aware of all the excellent effort that their countries have been taking, the measures that they've been taking to identify the high-risk practices, identify where there are risks of diseases jumping from animals to humans, designing strategies with their communities on how to protect themselves and the animals in their environment. And there are several projects. We have several WFA member organizations who have been working in the field with the countries, with the governments on these kinds of projects, and bringing those examples, showing the case studies, showing the evidence, has indeed given negotiators in these international processes the confidence, because they knew we're not expecting onerous obligations. There are efforts that they are already undertaking. And if those measures become part of an international commitment, then there's more support for those efforts. And then their neighboring countries are also investing in prevention. Because as we've seen, pathogens do not know borders. If one government is taking action, it's not enough. Other governments in the region should as well. And those case studies, those examples have helped a lot in the actual negotiations with Ellie and the colleagues.
Nina, as we wrap up, I want you to bring a practical angle to this. When you talk about prevention at source, what does that actually look like for those who don't understand what this is?
Prevention at source means prevention where the pathogen might jump from a wild animal to a domesticated animal, or from animals to humans. And those settings could be in nature, if people come into contact with wild animals for various reasons, whether contact in like normal contact or trade in wildlife, or hunting or poaching, coming into contact with animals that are farmed. For example, in fur farms, mink have been infected with COVID, but also highly pathogenic influenza. And those viruses have jumped from the mink to humans, or from humans to mink and then back. So prevention at source means to think about what's the earliest stage before a pathogen can jump from animals to humans. And designing those strategies will mean think about how can we protect these animals and their environment? How can we make sure that their welfare is secured so that they are not in a situation where they are infected, or where they can infect each other and then humans.
And from a broader perspective, Nina, when you look at biodiversity as a whole, before we look at individual animals, this even looks at protecting our forest, ensuring that the animals stay within the environments that they were meant to stay in. So looking at the wildlife corridors and separation between humans and wildlife, it's much broader than sometimes just the individual animals that we are talking about.
Absolutely. And this is also one of the examples of how interconnected protecting animals is with several other global priorities. So if we create these natural buffers between wild animals and humans or domesticated animals, this is one of the ways to keep to protect the animals, their habitats, and humans and domesticated animals. But it also contributes to other priorities that governments have: protecting biodiversity, addressing climate change, reversing desertification. So it's we all benefit, nature benefits, animals benefit, and we prevent the next crisis.
There are multiple benefits in protecting animals at the end of the day. So as we wrap up this session, thank you so much for everyone who's joined us today. I want to ask Julia and Nina, if you were to finalize with one statement or take away from this session that everyone should go remembering, what would that be in just 1 minute?
So I can go first. We are in a time of crisis, but there is reason for hope. And that reason for hope is that governments are starting to implement a One Health approach to prevent pandemics, protect animals, and are investing in health for all humans, animals, and the environment.
Julia?
Yes, I think I would just finalize that, that countries really have to be aware. It's really, I mean, they cannot really there's no longer a way to neglect animal welfare, also, especially farm animal welfare. So, because it concerns all of us. It's not only the animal that is suffering in the husbandry system, in the transport, or during slaughter. The suffering of the animal at the end of the day affects all of us. And this is, therefore, it's not only our ethical obligation to really care for the animal, it's caring for ourselves if we care for the animals. And I think people and also the governments have to understand this.
Thank you so much, Julia and Nina. I don't think I can add anything to what you've said. So we will share the slides from this session. We'll share the recording. And thank you so much, everyone, for dedicating your time this evening to join this session today. I hope you learned one or two things about these global policy processes, and we will keep you posted after the WOAH General Session that will be happening in September. Thank you so much.
Thank you, Masika. Thank you, everybody.